heart rate, blood volume, and cardiac output increases in pregnancy for the needs of the baby. In pregnancy, heart diseases which are most affected or those which convey highest risk are the obstructive lesions like mitral stenosis, pulmonary stenosis, aortic stenosis, and coarctation of aorta, the severe varieties. And those with pulmonary vascular obstruction having severe pulmonary hypertension are also adversely affected in pregnancy. The next group of disorders are the complex cyanotic congenital heart diseases. So these are the diseases which have highest risk in pregnancy. Regurgitant lesions are in general well tolerated in pregnancy. These are two representative lesions having high risk in pregnancy. One is severe aortic stenosis, obstructive lesion. Another is complex congenital heart disease, Taussig-Bing anomaly. In addition to this, those with coarctation of aorta, obstruction in the aorta, are also at high risk as they have a chance of aortic dissection forming in pregnancy, and during parturition there is chance for rupture of aorta as well in coarctation. Similarly, in mitral stenosis, when there is obstruction here, there is increase in pulmonary venous pressure. The tachycardia of pregnancy and increased blood volume of pregnancy are poorly tolerated when there is mitral stenosis. So that mitral stenosis is one cause for pulmonary edema in pregnancy. There are several types of classifications of risk of cardiovascular disease in pregnancy. We will discuss the World Health Organization classification into Class 1, those with very low risk in pregnancy. Class 2, low to moderate risk in pregnancy. Class 3, high risk in pregnancy. And Class 4, with extremely high risk in which pregnancy has to be avoided. Class 1 with very low risk includes mild pulmonary stenosis, small patent ductus arteriosus, and mitral valve prolapse. Successfully repaired simple lesions which include atrial and ventricular septal defects, patent ductus arteriosus, and anomalous pulmonary venous drainage, as well as isolated atrial or ventricular ectopic beats also come under the very low risk category. Class 2 with low to moderate risk include unoperated atrial or ventricular septal defects, repaired tetralogy of Fallot, and most arrhythmias. Mild left ventricular dysfunction, hypertrophic cardiomyopathy, Marfan syndrome without aortic dilatation, bicuspid aortic valve associated with aortic disease having aortic diameter less than 45 mm, native and tissue valvular disease which is not included in class 1 or 4, and repaired coarctation may be included in either class 2 or 3 depending on individual situations. Class 3 with high risk in pregnancy includes mechanical heart valves, systemic right ventricle as after atrial switch operation for transposition of great arteries, Fontan circulation, unrepaired cyanotic heart disease, other complex congenital heart diseases, Marfan syndrome with aortic diameter between 40 to 45 mm, and bicuspid aortic valve with aortic dilatation in the range of 45 to 50 mm. Class 4 is the extremely high risk category in which pregnancy is contraindicated. Includes pulmonary arterial hypertension of any cause, severe systemic ventricular dysfunction with left ventricular ejection fraction below 30%, New York Heart Association NYHA class 3 to 4, previous peripartum cardiomyopathy with any residual left ventricular dysfunction, severe mitral stenosis, and severe symptomatic aortic stenosis. Marfan syndrome with aortic dilatation more than 45 millimeters, aortic dilatation more than 50 millimeter associated with bicuspid aortic valve, and severe native coarctation of aorta.